Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and today we're going to be talking about pelvic pain. So pelvic pain can be tricky because there can be a lot of different causes of that pain. We're going to be focusing on two of those today. One is going to be a joint issue that irritates nerves and creates pain that way, and then another one is going to be muscle shortening or tightness, and we'll show you a couple stretches that can be done. First, we'll talk about the joints themselves. So the pelvis is the two bones that come together and that your spine rests inside of. And so your sacrum is the base of your spine, and that sits inside of the pelvis. There's a joint that where the sacrum comes together with the ilium is called the sacroiliac joint. So this joint moves when you walk, it's weight bearing, and when it gets stuck or if it doesn't move the way it's supposed to, it can get irritated. When this joint gets irritated, the pain can be referred around the side of the pelvis and also into the groin. So sometimes people will come in presenting with groin pain, but it's really coming from the SI joint. So I'm going to show you how we do an adjustment on the SI joint with our table here. Now this is a little bit different of an adjustment than what our manual adjustments normally are. So we're actually going to use the table to help assist in this. So the table will pop up like that. And what that does, it's just going to drop underneath Pat. And what that does is it allows us to put a little bit less force into the body and use the weight of gravity to get the results that we need. So I'll show you how we do that. So what we're going to do is we're going to look at, sorry about that, Brooke. We're going to be looking at his leg length down here. So his left leg is short, which means that his left pelvis has rotated back slightly and his right pelvis is rotated forward slightly. So we're going to do the adjustment to counteract that. And it sounds a lot worse than it is. It's a pretty light adjustment. And so what we're trying to do is get those back into alignment. When we do, we check his feet. Now his feet are back in line. So he was short, maybe about half an inch, which isn't a lot, but once we adjust the pelvis, they tend to even back out. So we're going to go into the PT area and we're going to do a couple of stretches for some muscles that can cause some pelvic pain. So the second major cause of pain that we see with pelvic pain is going to be muscle tightness or muscle shortening. So the two areas that I really see the most problems with when it comes to pelvic pain are going to be the IT bands, which is a band of tissue that runs from your knee up to your hip, and then also your psoas muscle, which is your hip flexor muscle, which allows your leg to go up like that. So it spans right here. So what we're going to do first with Kayla is we're going to do an IT band stretch. So I'm going to show you something that you can do, like if you have somebody at home, a husband, wife, boyfriend, girlfriend, they can help you with this. This is a two-person stretch and it's probably the most effective. Then afterwards we'll show you something that you can do on your own with foam rolling. Okay? So what I'm going to do is I'm going to bring the foot across like this. And then I'm going to put her leg up against, or her ankle up against my leg. And then I'm just going to slowly stretch to where I feel kind of the tightening start. Once you feel that, I'm going to have her press against my leg for a count of 2. So press against my leg, Kayla. And then relax. And when then they relax, you're able to go a little bit further. Press again. And relax. So you want to do this about 3 to 5 times. Press again. Relax. And that's 3 passes. We're here. We probably started out right here. So that can really help to stretch out that muscle and allow that to get a little bit looser so that the pelvis doesn't have extra torque on it. So the second stretch we're going to do is the psoas muscle. So I'm going to have you come down to the edge of the table. So scoot all the way down. And for this, you're going to have something that you can, that's hard enough. A bed would probably work. You can put your, basically put your rear end at the edge of the bed or at the table. So scoot all the way down. Keep coming, keep coming, keep coming, keep coming, keep coming. There you go. And then go all the way back, and then you're going to take one knee with you. And I'm going to have you come a little bit further forward. So scoot up a little bit. There you go. All right. So the key is going to be to press back against this knee so that this kind of pops this leg up. And then we're going to get a good stretch right there on the hip flexor. So once you come to a stopping point, then you're going to have them push up with their knee into your hand while you're resisting, then relax. Go a little bit further. Relax. One more. Relax. And the reason why we want them to be at the edge of the table is so that the leg can get pushed down as much as possible and really isolate the stretch on the hip flexors. So we're going to head into the gym and show how to do some foam rolling, so you can do that on your own.
Extension of the spine will help bring oxygen. Hi, this is Nancy Thompson, the Functional Fitness Specialist at the Springfield Wellness Center, talking to you today about pelvic pain and what Fitbits you can apply to dealing with that condition. Exercises like running, yoga, Pilates are all typically recommended exercises for great fitness. However, when you're dealing with something like pelvic pain, those high intensity or core-based exercises can often lead to exacerbation of pelvic pain symptoms and cause a lot of discomfort. However, there are a few things you can still do fitness-wise that can help you either gain some fitness or maintain your level of fitness while you're dealing with the pelvic pain condition. The first thing that is recommended quite often when dealing with pelvic pain is diaphragmatic breathing. This type of breathing, done in yoga, done in some other types of meditative practices, can really be effective in a couple different ways. The first thing with diaphragmatic breathing is when you breathe deep enough to engage the diaphragm, the pelvic floor muscles move with the diaphragm, causing some gentle movement and hopefully stress and tightness relief from those pelvic floor muscles. And then secondly, diaphragmatic breathing has actually been proven to reduce adrenaline and cortisol levels in people who practice it acutely or even over time as a regular practice. So when we reduce those stress hormones, pain is often reduced. And so between the gentle movement of the muscles and the reduction in stress hormone levels, you can really get some good pain reduction. The way you can practice diaphragmatic breathing is really anywhere at any time. You just have to mindfully do it. You could be standing, sitting, lying down. I'll practice it sitting today. You'll want to be tall and have a long spine, being mindful of that first, and then that'll leave room for you as you inhale deep enough through the nose to allow the lower belly to expand, and you actually should be able to feel that or see it expand when the diaphragm is activated. And then as you take your full inhale, you'll want to pause and then exhale the same amount of time and kind of feel or see the belly fall. And do that for 5 to 10 reps, multiple times a day. But certainly if you're in a moment of pain or stress, that's an ideal time to do it. But even making it a regular practice can even be more beneficial. The second thing you can do exercise-wise with pelvic pain is to actually perform isometric exercises using both limbs. And planks are actually okay exercise to do when you're experiencing pelvic pain, because we can engage lots of muscles without over-activating muscles that contribute to pelvic pain, such as the upper abdominals. So the way you practice planks are usually on the floor. On a firm surface, you'll want to either start on your elbows and knees, where you have a line from your ears through shoulders, hips, and knees. And for anybody beginning exercise, this would be a perfect place to start. You're engaging your shoulder complex, your hips and glutes, and quads. If you're a little bit more advanced, you can lift the knees off the floor. And this, again, stay in this isometric position for about 5 seconds. And then perhaps practice that for 5 to 10 reps. And that will build some fitness and strength in the core and the whole body actually, and provide, or even help you maintain a level of fitness if you're already a very active person. Thirdly, another active pose we can do for relieving some symptoms of pelvic pain and maintaining some fitness is squats. Now the modified squat is what you're going to want to do though. We don't want to take a deep squat in dealing with pelvic pain, because that can actually, again, trigger the symptoms and trigger over tightness of the pelvic floor muscles. But we can modify squats by just taking shallow squats They're going to activate, if you're doing them properly and thinking about what muscles you're using, the quads, the hamstrings, and the glutes. Again, do 5 to 10 reps, maybe 3 sets, and even doing that daily wouldn't be too often to again help you either gain a little bit of fitness and strength around the muscles of the pelvic floor and maintain some fitness. So you've got diaphragmatic breathing that can be used anytime, anywhere, planks that can be done daily, and shallow squats that can be done daily that could help you again perhaps just gain a little fitness or maintain fitness and health if you're dealing with pelvic pain. If this is helpful to you, please share it with someone else. This is Nancy Thompson, your functional fitness specialist at the Springfield Wellness Center.
So in case you don't have someone to help you with the stretch, we're going to show you how you can do it on your own with a foam roller. So if you haven't seen a foam roller before, basically all it is just hard foam that you're going to roll the length of the muscle across. So we're going to start with the IT band. So Kayla's going to be doing that for us. And what you want to do is make sure that you get the full length of the muscle, because this is going to stretch all the way from the knee all the way up to the hip. So you want to make sure that you're going for the full pass, because you never know where that problem is at inside of each individual person's IT band. So this one's a little bit painful, and you want to make sure that you're putting your weight on the IT band itself and really getting a good stretch in there. And so usually you can do 3 to 5 passes. If you can do more, then obviously that's better. So we're going to let Kayla off the hook here, because I'm sure that probably is hurting a little bit. All right, so the next one is going to be the psoas muscle. So that is going to be, you're going to lay face down on it, and you're going to start at the top of your pelvis, and you're going to run down to about mid-thigh. And you want to just do one side at a time as opposed to trying to do both at the same time. With one side, you'll be able to focus the foam rolling a little bit more intensely on each muscle. You're doing great, Kayla.
Thanks.
So same thing, you want to do that about 3 to 5 passes and really make sure that you're using your weight and gravity to be on top of the psoas muscle itself. So that explains what we do here in the office and what you can do at home for pelvic pain. If you have any questions, you can give us a call at 726-0422 or check us out on wellnessspringfield.com. If you found this information informative or useful, make sure that you like or share the post with someone who may be able to find it useful. And we'll talk to you later.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.